This lesson will teach about public assistance benefits for refugees. We will talk about the types of public benefits available in Utah, how to apply for these benefits, the requirements for participation, and the limitations of the benefits. Public assistance programs are short-term and are funded by state and federal governments to support low-income individuals and families to help them meet their basic needs and assist them towards financial security. These programs help with food, housing, healthcare access, childcare, pregnancy and childbirth, and employment assistance. These programs and their requirements vary from state to state. Today, we will learn about the public benefit programs in the state of Utah. Your case manager at Utah Valley Refugees will help you apply for these benefits, but they do not have control over which programs you are eligible for or how quickly you can receive assistance. These decisions are made by other organizations. Benefit eligibility can change often, so talk with your case manager to know which programs are currently available to you. The Department of Workforce Services has a food assistance program called SNAP, Supplemental Nutrition Assistance Program, for low-income people to help them buy food. You qualify for this program until your gross income is above 130% of the poverty level. Gross income means before taxes. The cutoff for net income, after taxes, is 100% of the poverty level. Scan the QR code on the slide to see the current income limits and benefit amounts by household size. Money for food is placed on your Utah EBT card each month on either the 5th, 11th, or 15th of each month, depending on your last name. You will need to complete a mandatory review every 6 months to verify that you are still eligible for this program. You will receive a letter from the Department of Workforce Services, DWS, with the needed documents to send in. These documents will include your pay stubs from work and your recent bank statements. If you do not turn in the documents for your review in time, your SNAP benefits will end and your account will be closed. You will have to reapply for the program, which can take up to 2 months. Refugees are eligible for cash assistance when they first arrive in the United States. This program provides temporary financial assistance to help you pay your bills until you get a job. Your case manager will help you apply during your first week in the U.S. The state of Utah is in charge of this program, and they determine how soon you can receive assistance. Utah Valley Refugees does not have control over how much assistance you receive or when you will receive it. You will then be assigned an employment counselor with the Refugee Services Office in Salt Lake City. They will meet with you each month and help you make an employment plan. You must attend these meetings to continue receiving assistance. If you have changes to your income or household, you must report them within 10 days of the change to your employment counselor. They may also request pay stubs or bank statements from you to verify your income. Once approved, funds will be loaded onto your Utah EBT card at the first of the month. These funds can be used like a debit card for any purchase. Be sure to select the cash option when checking out at the store because this EBT card also has your SNAP benefits for buying food. You can check the balance of your Utah EBT card by calling the number on the screen. The balance will also be on the bottom of your receipt when you use the EBT card at a store. To use the card, select EBT at the cash register. If buying eligible groceries, select food. If you're buying something that is not eligible for SNAP, you can select cash. For example, if you buy laundry soap. Never share your PIN with anyone and change it every month to keep it safe. If your benefits get stolen, they cannot be replaced, so keep your card information secure. Never sell your benefits. That is a federal crime, and you could go to jail or have to pay a fine. Medicaid is a health insurance program for low-income individuals and families to help them access medical care. Your income must be less than 133% of the poverty level to qualify. Scan the QR code on the slide to see the income eligibility chart. Medicaid covers basic doctor's visits like checkups, vaccines, vision care, and emergency services. It covers dental work for children, but not for adults. You will need to complete a mandatory review every 6 months to verify that you are still eligible for this program. You will receive a letter in the mail from the Department of Workforce Services with the needed documents to send in. These documents will include your pay stubs from work and your recent bank statements. If you fail to turn in your documents for your review on time, your Medicaid benefits will end and your account will be closed. You will need to reapply for the program, which can take up to 2 months. TANF, or Temporary Assistance for Needy Families, is a program similar to the Refugee Cash Assistance Program. Only those with children in the home under the age of 18 qualify. There is also an income limit requirement. Scan the QR code to see the income chart. You can participate in this program until your income is over 300% of the poverty level, or you've been participating for 36 months. DWS has a child care program to help pay for the daycare costs when you are first getting a job. The requirements are the same as the Medicaid program. The program will end once your income is above 133% of the poverty level. HEAT is a utility assistance program for low-income families. The program can help pay for your electricity and gas bills for up to 1 year. You qualify until your income is above 150% of the poverty guidelines. Scan the QR code on the slide to see the amount for your family. You can apply online with your case manager's help or at the local DWS office. WIC is a nutrition and education assistance program for low-income women, infants, and children. The program provides money on a benefit card to buy food each month. The foods you can buy are listed on the WIC website. You can only buy a specified amount of each food every month. You are qualified as long as your income is below 185% of the poverty guidelines. You must attend regular classes and meetings at your local WIC clinic to participate. In summary, there are several benefit programs available to help you in your first year in the United States. These programs require regular reviews, so be sure to ask your case manager for help when you get an email or letter from these programs. Otherwise, your benefits could be cut early. These programs are short-term in nature. You will be moved off of these programs once your income is above the income limit, so that others can use the programs who really need them. If you have any questions, please talk to your case manager.